Hey guys, welcome back to Community Medicine, a channel I discuss matters health. Thank you very much for taking your time to join me in today's discussion. So today we shall be looking at urinary tract infection or UTI in males. So I'd previously done a video on UTI in general, but today I've decided to be a little bit more specific. So make sure that you join me till the end of the video. So a UTI is a bacterial infection which occurs when bacteria gets into the urinary system or the urinary tract through the urethra. This bacteria may multiply and then end up spreading to the entire urinary tract in case one is not treated. So when we talk of the urinary tract, we are referring to the kidneys, the ureters. Actually, urine is normally formed in the kidneys. And then we have the ureters, we have the bladder where urine is stored, and then we have the urethra. So females are at a much higher risk of developing a UTI or acquiring a UTI, and this is because they have a shorter urethra as compared to men who do have a long urethra. So this means that bacteria will need to travel for a long distance for this bacteria gets into the urinary tract. So what are some of the risk factors to a male acquiring a UTI? One of them is enlargement of the prostate. This could be due to a conditions like benign prostate hyperplasia or BPH, which is actually age-related enlargement of the prostate gland, and it is common among males from 60 years and above. And then you also have cancer of the prostate. So this can also lead to enlargement of the prostate gland. So in case the prostate gland gets enlarged, what would happen is that there would be obstruction or blockage to the flow of urine, which would in turn encourage multiplication of bacteria and hence one developing a UTI. Something else is having sexually transmitted infections, especially if they are not treated. So most STIs are normally caused by bacteria like chlamydia, gonorrhea. So if these bacteria or if these STIs are not treated, these very bacteria may end up causing a UTI. And then we have a weakened immune system, which could be due to conditions like diabetes, cancer, or even HIV. And then having urinary tract abnormalities, which could be either congenital, meaning that one was born with these abnormalities, or non-congenital, whereby you find that an individual acquired these abnormalities at some point in their life. Then we have taking so long without passing urine. So urine is actually a good media for bacterial multiplication. Remember that urine is a waste product. So if this urine stays stagnated at one point for long, it would encourage multiplication of bacteria. Then we have urinary stones, which can also lead to blockage or obstruction to the flow of urine and hence encouraging multiplication of bacteria. Another thing is urethral stricture or narrowing of the urethra, which could be due to maybe infections or surgeries. So this can also lead to obstruction to the flow of urine. Then something else is having a catheter in situ that is not normally changed frequently. So this can also encourage multiplication of bacteria and hence lead to one developing a UTI. And by the way, the most common cause of UTIs in males from 50 years and above is BPH. And then from 50 years below 50 years, the most common cause of UTIs is STIs or sexually transmitted infections. So how does a UTI present in males? So most of the signs and symptoms of a UTI in males are similar to those in females, and they include pain while passing urine or burning sensation while passing urine. We have frequent urge to pass urine, and then we have sudden urge to urinate. And then one may have foul smelling urine, cloudy urine, Some may experience blood in urine, pus in urine. Some may experience penile discharge, and some may experience pain in the central lower part of the abdomen, which is the suprapubic region. And then some may experience inability to start urinating, whereby you find that one has got the urge to pass urine, and when they get into the washrooms, they find it difficult to start urinating. And some may even have a weak stream, or you may find that urine is flowing out very slowly. Some may only pass very small amounts of urine, and some may experience lower backache. So a UTI needs to be treated promptly. So in case it's not treated, it may spread into the kidneys. If the infection has spread to the kidneys, one may experience fever, chills, nausea and vomiting, and pain on the upper back. So there are several investigations that can be carried out in order to confirm the diagnosis. For example, a urine analysis. Then you have urine microscopic culture and sensitivity. You can have some investigations like ultrasound of the kidney, ureters, and the bladder. Most UTIs in males are as a result of an underlying condition or an underlying cause. So it's important to see a urologist in case you're having urinary stones, you have urethral strictures, you have cancer of the prostate, you have BPH, you have abnormalities of the urinary tract, so that these issues are addressed, and this way the UTI will be treated. And then if you have an STI, make sure that it's treated. Make sure that you also drink plenty of fluids, because these will help to flush out bacteria. Your doctor would also advise you on the right choice of antibiotics to treat the UTI. Make sure that you also boost your immune system, so that you're able to avoid developing a UTI frequently, or you're able to overcome this infection. Thank you very much for your time. Kindly don't forget to subscribe, to like, and to share this video if you found the video useful and informative. Bye bye, and see you in the next.